Hello and welcome to 18 WJTS in.form. I'm your host, Bill Potter. We are lucky to have in the studio today with us some health insurance navigators or healthcare navigators who are going to give us some information about how you can check out health insurance since we're in the open enrollment period. And joining us in the studio is Ammer Williams, and she is a healthcare navigator out of Vanderburgh County, but you also work in this area as well?
Yes.
Okay. And also, mostly working in this area is Lesa Seng. She is a healthcare navigator. Okay, you're healthcare navigators. What is your purpose, and who are you helping?
We are helping everyone in the community with health insurance enrollment assistance. So we help people get enrolled with everything from your state programs, from the Medicaid, HIP, Hoosier HealthWise, to the federal programs, which is your marketplace.
So you're really helping out anybody in the area who wants to know more about health insurance or to sign up for that. Is that right?
Yes. Absolutely.
So you could even be helping somebody, say, that has insurance already, but they just wants to check out a few things, but they got to be cautious of things, which we're going to point out. There is a lot to healthcare navigation, and it really is going to start with a phone call.
Yes.
So if somebody is interested, who should they call? Where should they call? What do they do? Because you're through TryCap.
Yes. There's many ways that they can get in touch with one of their local navigators. They can go on our website, on the TryCap website. They can go on the CKF, which is Covering Kids and Families of Indiana website, and they can make an appointment directly on there. We have an online scheduler. We also have a 1-800 number that they can dial into and dial the first 5 letters of their county, and it will connect them directly to a navigator in that county. Or they can call our offices directly. One of us, we have, all of us have lines in all 5 counties, in Pike, Posey, DuBois, Warwick, and Vanderburgh counties.
And I mentioned that it starts with a phone call, but that's really not where it ends because there also needs to be some one-on-one interaction.
Mm-hmm. Yes.
Is that right?
Yes.
So what will folks, they'll call, they can ask you questions, but then they'll need at some point to come in and meet with you?
That's right. Any of the programs that they're going to be interested in, we're going to need their income first and foremost, income-based, and then the number in the household. For the federal program, ages, location, because prices do run different in different areas of the state. So it helps a whole lot if they come prepared, and especially when we get into marketplace. They want to bring their list of doctors and medications to get the best deal and the needs that make sure their needs are met. They need to come prepared with that.
Once they come into the office, we can plug those things in on the website, their providers and their medications, and when we pull up those available plans to them, it will show us if they're a network or if that provider accepts that, or if that medication is in the formulary for there to be covered on that plan.
Because I know that's always a concern. If I get this plan in DuBois County, it may not help me because I have to go to Bloomington to see a doctor or something, but you'll sit down with them, and if they bring the information you need and tell them, yes, Dr. A is available in DuBois County and you are covered, or this medication that you're on is covered.
That's right.
This all kind of goes back to the Affordable Care Act. And when we say the health care marketplace, we're talking about that thing you have to go online and put in all kinds of information. And some of that, not that it's tricky, but it can be confusing for folks to answer that. And that's what you do?
Very much so.
That's where you're helping?
Yes, we kind of play that middleman in between there, and we make sure that they get their application done correctly, all the information entered, any documentation that they need. We take it over to the FSSA office, or we can upload it onto the marketplace, depending on which policy they're doing. We can help them obtain documentation if they're missing that birth certificate or that Social Security card or their paycheck stubs. We can help them with resources to get those, and get them turned in correctly and in a timely manner, because they're also on a time schedule. They have to be, submitted in a time frame for that application to be processed.
And we are in a period of open enrollment, which goes until December
15th.
15th. Okay. What does it mean by open enrollment? What's the point of that? I mean, if somebody has health insurance, do they need to do this? I mean, if they went on the marketplace last year with you, will they need to do it again?
They should.
Okay.
They'll get a notice from the marketplace alerting them that they'll be assigned the same carrier if it's available, if not, something very comparable. But I've just always found that it's best, it's called the marketplace, and you should shop it like the marketplace.
Absolutely.
Because each year The carriers can and do change, and prices certainly change. So it's in your best interest to upgrade your application each year and shop the exchange.
You are not really health insurance agents. You're not out to sell a policy. You're out to help them find
Absolutely
the policy
right.
because you don't get commission.
We don't
You're
get
not
any
getting anything
kickbacks.
over this, right?
Yeah, we get no kickbacks or anything
No,
like that.
We're not affiliated with any insurance company.
Yeah.
We're Navigators. There's a big difference.
We're
This
here-
is really just a nice service, again, that TryCap offers, which is like 100 million things that they do.
Yes, we do offer quite a few services there, but we're here for the consumer and we're here for the client. You know, we're trying to see what's in their best interest and get them enrolled in that healthcare, because a lot of people don't realize the process, understand the process, or realize what they're eligible for. There may be a program out there that they're eligible for that they had no idea even existed, and so we're here to help facilitate that and get them on the road to, you know, being self-sufficient and that self-sustainability that they need. And we also do internal and external referrals for other TryCap programs. So even though we deal specifically in insurance, there's a lot of programs out there that people don't know about that TryCap does offer, and we try to put them on the path any way we can to help them in all avenues. So
TryCap is well known for helping those who are needy or who are at a certain level in the poverty level. Or that's not necessarily the case with healthcare navigation. It could be anybody.
It can be anybody.
Right.
Absolutely. I've worked with many people that are interested in taking early retirement and want to check ahead of time to see if they feel like they can afford to and what their health care will cost them on the exchange if they would decide to retire. Worked with many self-employed people that obviously if they're self-employed they don't have their insurance through a company. So getting them the best deal and services that they can hopefully afford. So no. And also one other thing, this is something that throughout the year clients' situation can change. You can have a loss of income, a job change that doesn't offer coverage any longer. I mean, so this does keep us busy throughout the year. It is not during just open enrollment. So, we see people all year long.
we enroll in the state programs, in your HIP, Who's Your Health Wise, any of the Medicaid programs, 365 days a year. And even though open enrollment that we're in right now for the marketplace does run until December 15th, there are, like Lesa mentioned, certain circumstances that can qualify someone for something called an SEP, which is a special enrollment period, if they do have a qualifying life-changing event, such as having a baby, losing a job, having a status change, that may qualify them to enroll at any time during the year. And we can help facilitate that as well.
So they could call you in March, even though it's well past and you should have had your insurance lined up, because things change for them.
Yeah.
And you'll help them all over again, because the marketplace still exists.
Absolutely.
It exists all the time. But now is like the crunch time
Yes.
to kind of review everything.
Now is that open period where they don't have to qualify for the special enrollment period. They don't have to have a life-changing event. It is that time for them to come in, reevaluate the plan that they do have, see if there's anything better out there, see if their services are still going to be covered by that carrier, or see if they qualify for some other type of program.
And this is a free service?
Free
Absolutely.
All you
free.
really got to do is start it off by calling TryCap or going online.
That's right.
But they're going to, at some point, like we mentioned, meet with you.
Yes.
Because
Yes.
they are going to have some information that you have to actually enter into the
Yes.
computer. So you're really helping them to navigate through that, not that it's really confusing, but somewhat confusing
Can be very,
website.
yeah.
Because it asks questions that I'm not sure how to answer this question, and you can answer that for them.
Absolutely.
Typically, how does it work? Somebody's just going to give you a phone call, then what's the next step, and then what's the next step, and then what's the next step for them?
They're going to give us a phone call, and we're going to set up a date and time, ideally that they can come in and sit down and meet with us for an appointment and go over their, all their household information and see what we can come up with.
Can they pretty well in that one time take care of it all the way through and say, okay, this is the policy I want, and I'm done?
They can. Some people, if the time frame allows, they want to think it over a little bit more. But yes, you absolutely can. You can enroll on spot, or you can take it with you, all the information, and think it over and come back in to enroll. Yes.
Why is December 15th set as the date? That's not a date you set. That's a government set date, right?
Yes.
So people have
Yes.
to have their insurance lined up by then?
Yes.
Yes.
Okay.
That for the open enrollment on the marketplace, on the federal programs.
For January 1 coverage on the, yes.
Yes.
What if somebody doesn't do it until the 17th of December? What happens to them? Can they just not get insurance unless they have a life-changing event?
Unless they qualify for that SEP, that special enrollment period, once it's past that December 15th, they have to have some type of special circumstance that qualifies them to get on there and enroll for their coverage to begin January 1 of 2020, unfortunately.
And it gets a little confusing, and this is where they maybe can find out with a phone call through you. Somebody may be working for a company like I am, and I'm getting company-provided health insurance, but I just want to, I want to change for some reason, whatever that may be. If my company offers insurance, I generally can't get another policy unless there's certain qualifications. That's why it's important to have somebody like you to help them through and answer those questions.
Absolutely.
Typically, then, you're dealing with all ages pretty well. I guess 18 plus.
Well, all ages. We don't typically deal with Medicare, which is 65 and above. Some people are eligible for some dual enrollment that we've been working with Medicaid and Medicare, but those are very specialized cases. So, but typically we deal with 18 to 60 till they turn 65. Yeah.
Okay. Is there anything that you'd like to add or like people to know? Because first of all, it seems confusing, but it's not to you because you understand. It's probably scary to some people. So the most important thing is just give you a call.
Yeah, and all of our team are licensed, certified navigators. We've went through training. We've passed the test. We're all licensed in the state of Indiana. We have continuing education that we go through every year. Covering kids and families is statewide now. We're in all 92 counties. And we are here for the client. It's a free, unbiased service. We don't push anything on the client. We don't suggest one carrier or another. We're there just to give them the best information based on their situation and try to help them out any way possible that we can and show them just what's out there and what works best for every case is different. It's a circumstantial case. So.
And it's a free service.
Absolutely.
Now, somebody pays for that, so basically we're paying for that through tax dollars to help fund your organization. So don't feel like you're going to have to pay them. It's just what you do. It's what TryCap offers.
Yeah, completely free.
Are you only available for TryCap counties? Or
like I said, covering kids and families is it's statewide. We're in 92 counties. We all work under different agencies, like we work under the TryCap agency. But when they call that 1-800 number and they enter the first 5 letters of their county, they will be directly connected to a navigator in their county. So there is somebody in every county working for CKF that has a healthcare navigator that can assist them.
What are the hours that people need to contact you?
Normally, we work 8:30 to 4:30, but we do make special appointments for people. We realize there's times like us, most people work 9 to 5, 8 to 4. So we do make our best effort to try and get people in. I know Lesa and I both have done Saturday appointments and events, or we've worked late in the evening. So we will try and accommodate, that client's needs because we know how important it is to keep their job and get an appointment as well. Yeah.
And I think to go back to your previous question, if we get a call from someone out of our area, county area, absolutely we'll see them. The bottom line is to find health coverage. We're not going to turn you down.
No.
Okay. Yeah. And what is the number to call?
Locally here?
Yes, because I cannot think of the number.
Oh, it's fine.
I was trying to give you the 1-800 number too. Sorry.
Okay, yes.
TryCap locally, 812-482-2233.
And then the 800 number?
They can get on the CKF of Indiana.org and get our number off there, or they can schedule directly on there. There's an online scheduler. They can put in their information, pick a date, time, and office, and automatically have an appointment.
If somebody would come and meet you in person, about how long are they committing? An hour?
I generally say an hour. I have had 3-hour appointments.
Okay.
It totally, truly
Yes.
does depend.
And if it's a 3-hour appointment, that means if you were doing this at home, it's an 8-hour time on your computer. So much better to have you folks helping all the way around. Anything you'd like to add?
I feel like we've pretty well covered it all. Again, we're there, for the clients. We're there for you. So
And no
take
question
advantage
is
of it.
no question is too small. Even if you don't have any intention of having an appointment or doing a whole enrollment, if you have questions about your health care or anything that you need assistance with as far as that's concerned, please feel free to call us. We will answer questions over the phone. We will try to do our best to direct you in the right direction or get you whatever coverage that you need.
And obviously, this is all confidential.
Yes.
Okay, so
Yes.
keep that in mind as well. So contact the TryCap office. We would like to thank you, ladies, for coming in, because I know that can be somewhat scary for folks. You're not alone. They'll be glad to help you out. Give them a call, set up an appointment, and meet with them. We have had as our guest Lesa Seng. She is a healthcare navigator. Also joining us is Ammer Williams. She is also a healthcare navigator. In the local area, you're most likely going to work or call and talk to Lesa in the Vanderbilt County area. You oversee pretty well all of them.
Yeah,
Okay.
over all 5 counties, and I can direct you to a navigator in any of those counties. So get in touch with one of us, and we'll get you where you need to be.
Okay, don't hold back. Give them a call. They're glad they are here, really. Basically, if we're paying tax dollars, we're paying for you to help us.
Absolutely.
So make sure you take advantage of that. Thanks, ladies. Thank
Thank
you for
you.
watching 18 WJTS in Form. We are local people watching local people.